Assalamu alaikum, my dear candidates. Good evening to all. Today, our mock like session, long clinical case consultation, and ongoing result releasing, and really happy that new system and the passing rate little bit good rather than before. And long clinical case consultation, good time managing patient, everything is really nice, and it's really appreciated to the Royal College of the physician that newly guideline, new approach, and the passing rate rather than BCC, LCC is best. That the according to the rate is really appreciated. So today we'll start very common case ongoing, very newly and common case ongoing diet 2, diet 3. So few candidates requested according to that. I just announcing the name. Dr. Amani is here. Just for ensuring my voice is clear, anyone kindly ensure my voice is clear. Okay, Dr. Amani is here, right? Yes. Just I'm asking regarding your name. Okay, Dr. Amani. So today your long clinical case consultation, and as you have also exam very near, so we'll start. I'll give you 3 minutes for your preparation time. Then we'll start our discussion. Right, Dr. Amani, are you prepared?
Okay.
Okay. So start. Timer is on. Are you ready, doctor?
Yes, ready.
Okay. Start, doctor.
Hello, I'm a Dr. Ahmed. I'm a medical in our clinic today. May I confirm you are Mr. David and your age is 45?
Yes, doctor. You can say me Lawrence.
Orange?
Yes.
Okay. We are here to discuss some issue related to your health and we will examine you. It's okay to you?
It's fine for me, doctor.
Okay. It came to my knowledge you are complaining of a cough for 7 months. Can you tell me more about this problem, please?
Patient is still coughing in your front for your discussion. So, doctor, yes, it's really very much terrible for me, this coughing, and it is increasing nowadays, and I'm very much afraid of this kind of the coughing, and I'm taking so much medication to decrease it, but nothing is improving. It is started for the 7 months, but it's more around that's the last 2 weeks.
I'm so sorry to hearing that. We are here to help you and support you. Okay. It started 7 months. It's the first time?
It is first time, doctor.
Okay. Now it's increasing or decreasing or the same?
As I said, it's for the last 2 weeks. Even I'm coughing every time. It's not stopping. Even I'm taking some syrup, like some things to decrease it. And many of my friends and colleagues telling me that I need to take care about that. So I just visited to you. Is there any serious condition running on myself?
Okay. I'm so sorry to hearing that. It's okay in awful all the time or all the time?
All the time, doctor. But I feel that it's really more at the night.
More in the night. Yes?
Yes, doctor. Yes, doctor. I feeling. It's
Okay.
my feeling that
Okay.
I can't. I just can't stop it. There's a coughing and coughing.
Okay. I'm so sorry to hearing that. It's dry or contain phlegm?
Doctor, yes, honestly, what happened 3 months ago, it's little bit, it was dry, and I have some medication, and my GP, he said it could be a possibility, so that he stopped it. But even after stopping this medication, I still coughing, and now I'm seeing that's like some flame is there.
Okay. This phlegm, it's what's the color of this phlegm?
As you can see, it's clear, fluent.
Clear?
Yes.
It's a large amount?
Now, just I can't say appropriately. You can see it's yes, like a spoon.
Okay, it contains blood?
No, doctor, I didn't see any time.
Okay. This cough associated with a high fever, high temperature, sorry.
A temperature still looks normal, doctor.
Okay. Associated with shortness of breath.
I didn't have any kind of difficulty of breathing. I only just coughing.
Okay. There is any chest pain,
I don't have any kind of chest pain, doctor.
any runny nose,
No, it's not like that. Sometimes I feel stuff my nose, but it's okay for me now. It could be some seasonal, I think so,
okay.
but it's okay now.
Okay, there is any racing in your heartbeat,
No, doctor?
uh, any lower limb swelling.
No, doctor.
Okay. Any contact with the sick patient or a patient with long-standing cough.
No, doctor?
Okay. There is any history of the acid thrush or heart pain.
It is a little bit, yes, I can see. It's like for the 4 months I have, but for that reason, my doctor's given some, I mean, it called some antacid like syrup. Okay, but I think so. It is not improving. Even it's decreasing some acid test sensation. It's okay for me, but it is not bothering me a lot. This acid test sensation, but my coughing is bothering me a lot.
Okay. There is any history of tummy pain,
No, doctor.
tummy distension.
No, doctor.
Okay. Change in your eye color.
No, doctor.
Any change in your bowel motion.
No, doctor.
Okay. You need to working at night to clear your throat.
No, doctor. Just I have to cough, that's
Uh,
it, but not to clear my throat. It's not like that.
okay. Does have any noisy chest?
I don't think so, but you can hear. I don't think so.
Okay. There is any past medical history should aware of?
Doctor, I have blood pressure high, for last 2 years, and yeah, there's some medication. It's called some Remipryl, and my GP changes recently. But and as he said that it could be a possibility, but it doesn't mean sense. It means it nothing improving.
Can you give me your medication list apart from AC inhibitor?
Yes, now I'm taking amlodipine and I'm also taking salbutamol, my GP given for my this cough and some syrup like for the decreasing this congestion of this coughing.
Why you take salbutamol?
As my GP thinking that it could be related to the asthma, but I believe it couldn't be. But how it possible? But my GP thinks so.
There is any family history of asthma?
Actually, doctor, I'm adopted.
Huh? I can hear what?
I'm adopted, doctor. I don't know my family really.
Okay, okay, okay. There is any history? There is any joint pain?
No, doctor.
Any rashes in your body?
I don't think so.
Okay. Um, uh, okay. There is any headache,
No, doctor, I don't have any headache.
loss of conscious,
Loss of consciousness? No, doctor.
any abnormal movement?
Abnormal movement? No, doctor.
Any weakness?
No, doctor.
Abnormal sensation?
Where, doctor?
Mm, in all of the body, in abnormal sensation. There is,
What this mean? I mean, what type of sensation? Actually, I couldn't get your question.
I can't hear you. What?
I'm telling. What about this sensation? I mean, what type of sensation you are asking? I'm good. Not getting.
Light tingling, numbness in your
No,
body.
no, no, doctor. No, doctor.
Okay. There is any hand shaking,
No, doctor.
heat intolerance.
No, doctor.
Um, okay. Uh, okay. What is your job?
Actually, doctor, as an shopkeeper, recently I started a bakery shop.
Okay. Does this symptom affecting your job or daily activity?
Yes, as I'm coughing more and I'm really afraid for losing my job because I'm coughing and I can't do anything. It's really very much afraid of that. What could be possibility? It is this serious, doctor.
I am so sorry to hearing that. I highly appreciate your feeling. But we need more information from you and examination uh, to know the reason. And according to this issue, I will refer you to occupation health worker.
Thank you,
Can you
doctor.
ask
Do you
me,
think that my this job can affect with this kind of this cough? Do you think?
according your job,
Yes. Is it related to my job, doctor?
do you have any contact with uh, can you repeat what's your job? Sorry.
Bakery shop.
Okay, there is any contact with any bear?
No, doctor.
Okay. Um, According to this issue, I want to know more information from you and about history and examination. I will answer your concern. Okay.
Sure, doctor.
Okay. Do you smoke?
Yes, doctor.
How many cigarettes per day?
It could be 3 to 4 cigarette.
For how long?
Around 5 year.
Okay. I advise you to stop smoking because it's harm to your health, and if not mind, I will refer you to smoking cessation center.
Okay, doctor.
Yeah. Do you drink alcohol?
No, doctor.
Okay. There is any history of recent travel?
As I said, yeah, I was traveling in India on my relative wedding ceremony. I was there 3 months ago.
Okay. In rural or urban area?
You can say it's urban.
Okay. Uh, do you have any sharing needle?
No,
Sorry for
doctor.
asking that. Any tattooing?
No, doctor.
I ask a private question?
Sure, doctor.
Do you have any partner?
No, doctor.
Okay. Uh, do you use any illicit drug?
No, doctor.
Okay. What is your concern?
I'm very afraid. It's serious, doctor. What do you think? Is it related to my job? And do I need to change it? I am not. I'm very afraid because it's a long time later I got a job. But many of my colleagues said it could be a possibility. I don't think so, doctor. What do you think?
Uh, uh,
Two
okay,
minutes
but
left.
okay. Do you feel better in the weekend apart from the job?
I didn't notice, doctor, actually.
Okay. Before you're answering your concern, I should examine you, if not mine.
Okay, doctor.
I want to examine the chest
Okay.
of the
What
patient.
do you want?
What's
What do you
find
want to start?
or by inspection, looking for any scar, any change in color, any visible pulsation. Then I want to see the chest movement.
Mm-hmm.
There is an abnormality.
No
Chest
abnormality.
movement.
No abnormality.
Okay. I want to do the chest expansion.
Okay. Chest expansion. Reduce bilaterally lower joint.
Lower loop.
Bilaterally, just it's reduced.
Okay. I want to listen to the heart sound. Breathing sound. What about breathing sound?
There's a bronchial and there's a creps.
In the lower loop. Yes.
No, it's a bilateral crepitation present. So there is also, you can say there is a prolonged expiration. Yeah,
Which loop? Which loop?
both bilaterally.
In lower loop, middle loop, upper loop, where?
It's a mid to lower.
Middle, lower. Okay. After coughing, the crackles still or will resolve?
No, it's ongoing. Your time is up, but I'm giving you 1 minute more in the place, kindly.
Okay. I want to check the nose and clubbing. There is anything?
No,
Um, okay. I want to answer your concern.
okay, doctor.
There is
What happened to me?
okay. Okay. There is according to the history and examination, there is possibility. One of the possibility um, condition maybe related to your job.
Time is up, doctor. Okay, I'm just giving 30 seconds. As in exam, you'll get 1 minute for recap, but I'm giving 30 seconds for recap, then I'll start again. So, doctor, could you tell me what are the differential in your case, or you have diagnosis?
Could be asthma.
Okay.
Uh, and maybe lung fibrosis.
Okay.
Um,
Anything else?
infection, but again, is that there is no high temperature.
Okay. So your first of all, your diagnosis is that simple asthma or anything you want to add here? I mean, for your differential or is simple asthma? What do you think?
Occupational asthma.
Okay. So, doctor, could you tell me how you will manage your case?
Uh, Starting by investigation, we need investigation in this patient to reach a diagnosis. Still, to me, is vague. I'm not reaching the actual diagnosis. We need to start by the general investigation, like a CBC, LFT, RFT, inflammatory marker. I want to do also the lung function test, chest X-ray, um, and I want to do also the reversibility, reversibility. If the picture obstructive, I want to do reversibility test, and I want to do the serial big respiratory flow in the job, and away and apart from the job.
Doctor,
And high
can you tell me how you will differentiate from the chronic obstructive pulmonary disease and asthma? Is there any possibility of COPD? How you want to differentiate in between?
also true it is obstructive, but the reversibility test can differentiate between asthma and COPD.
Okay.
In the asthma, there is positive reversibility test.
Doctor, what do you think regarding your management? How will proceed for the management of this patient?
Mm, if in the emphysema or COPD, I will give the bronchodilator, and also there is a rule of a lung reduction, a lung reduction volume for emphysema. And also stop smoking at all. And
Okay, doctor, your time is
oh,
up. Thank you, doctor.
okay.
So I just working your skill. Then I'll hear about your performance yourself and from my other candidates from the Zoom who are there. Then we'll discuss regarding this recent case which ongoing. First of all, Dr. Amina, from your performance, you have to be a little bit organized. Your organization is not appreciating, okay? Regarding the cough, and first I'm starting with the clinical communication. Cough and patients frequently is worried about this job and frequently worried about is it serious, you didn't answer, so concern totally lost, so concern fully you lost. There is nothing you manage according to concern. You have to ensure that how you are afraid, we are here to help you, don't be afraid. This way you have to ensure concern marking totally you didn't get any mark here. Second, regarding the clinical communication, and as is it is not appropriate according to the organized the cough variant, sputum, aggravating, relieving factor. Though you ask in general, is there any pest case in your home? Is there any new job? We get any association, aggravate. If you just simply say, is there any aggravating factor? Never say, never. It's never. It's a now ongoing 15, 14 minutes, not BCC simply, okay, fine, tell me what happened. No. You must to say, is there any pest case on your home? Is there any aggravating factor, pest fumes, any seasonal variance, any post medical history, in any childhood asthma do you have? Specific, obviously specific. Neither communication skill, they will not give you any mark. So communication are just giving the borderline. 2, identifying physical sign, you just catch by auscultation. I'm giving you there's a positive finding in real exam also. There is a wheeze, there is a restriction bilaterally, there is a bronchial sound. So overall, it's acute exacerbation of asthma along with the occupational asthma. So there is a identifying physical sign, you get full mark for. Physical examination skill, actually, as it is in your case of the real patient, if you think what will you will do, first of all, offer the examiner, I want to do the bedside saturation test. Though they'll tell you it's outside same, so no saturation dropping, just you have to offer it saturation, temperature check. In this moment, whatever the temperature, they'll help you, okay? Because this is the vitals, you must to say it is acute infective exacerbation or not. You just say, do you have any high temperature? It doesn't sense make, but now it could be a temperature, it could be the acute exacerbation. So you have to ask that, I want to check the high temperature or not, is temperature chart or is this elevated or not, you have to offer it. So vitals here is very important. Even though there is a just correlation anemia jaundice in mouth sore, there's just you are excluding any kind of the vasculitis or not, the overall screening of the examination it was missed. But physical examination overall, if you say the full mark, I'm just giving the borderline. So regarding the differential, you just stop by saying the asthma. It not sounds like good. You have to say that it is occupational asthma, that when it started, bakery job, bakery shop, what you do actually. There is the flowers, fumes, right? There is a, whenever they do some baking, so they have sometimes of the exposure of the fumes. So this aggravating factor, you just say what about your any kind of the off day of dairy, any kind of the diary you are using or not. Actually the sounds like not good, so you have to be very organized approach. So this way managing patient concern was missed. Clinical judgment, yes, you say nicely, but ABG, bedside X-ray, you said HRCT, pulmonary function. I'm not cutting any mark here. Clinical judgment, I'm giving overall 3. And the patient's the differentials AC inhibitor induced, it could be a factor, but it is stopped already. But you can give, as I said, I just excluded what DD 1, 2, 3, 4 this way. You excluded only asthma, COPD, or any kind of the drug aggravating factor, only patient AC inhibitor, any kind of occupation related. So the sounds not like good. So here it is was acute exacerbation asthma, occupation related. Second, it could be AC inhibitor. GERD, patient is scared taking Gaviscon. This is not bother, but you can't keep it, or it could be that post nasal drip as well. But you already exclude by asking the question. So overall, I'm giving here 3. So overall mark here you will get like 20 or 22 this way. Dr. Amani, clear? Any confusion, any question here? Do you have? Anyone have any question? Or Dr. Amani, you can ask me any question here, because this is a recent exam case. Then I'll start the cough related discussion.
Dr. Irene,
Yes, sure.
is the person known to be asthmatic?
No, patient don't know, but that you have to ask the childhood history. If they say what about your childhood, I said that I'm adopted, but is there anything that make it worse, like any kind of fumes, any kind of the seasonal variant? I'll say yes, but it's not sounds like you are diagnosed or not. It's not diagnosed case, but it could be aggravating factor, seasonal variant. Okay,
Okay,
you
so
have
it
to
is a
diagnose
confession
here.
in this
Yeah,
patient.
it's a yes, you're right, doctor.
Okay. Should we ask about when we started your last
Job,
job,
yeah,
and
yes,
what
very
about this?
important.
Okay.
Yes, very
Thank you.
important. It's a very important. They'll cut down if you don't ask when you started the job. I said it's the last 1 year. I don't have any job. I started this. Is it? Do you think that I lost my job? Same question was in real exam. Do you think that I lost my job? Even vaccination. You, Dr. Amani, didn't ask me. Whatever vaccination, is there any recent vaccination? You cover all the vaccination. Very important vaccination schedule. You cover all. Whatever the COVID vaccination, every point. Cough variant, seasonal variant, asthma, this type of the respiratory mean vaccination must. You have to cover those. Any question?
Dr. Ernie, but
Yes.
confuse me. The examination findings confuse me.
Yeah, cause
Bilateral
aggravation.
lower.
Yeah, this aggravation, aggravated of the asthma. If you ask the how whatever the temperature, I will say it's mildly raised. Mean acute exacerbation now. Aggravating factor, cause I said now 2 to 3 days or 2 weeks, it's a more. Mean now acute exacerbation asthma now. Okay.
Okay.
If no question, we want to start our discussion. This is the real case picture. Just all was written according to the candidate's approach. Just I want to say how to start in real exam, because very common. So cough related discussion, I want to say it could be productive, it could be dry, right? We know very well the first fibrosis, aspiration, sarcoidosis, tuberculosis tumor. So according to the first fibrosis, Dr. Amani nicely asked any kind of the any kind of disease. Just you have to joint pain rush. Don't as always try to practice in different. I mean, how to look nice to the examiner. I mean, do you have any kind of the disease like joint pain, rheumatoid, any known case you have, any known kind of the medication like methotrexate, just to say that yes, I know these are the cause. It could be possibilities. So drugs, methotrexate, nitrofurantoin, any kind of the new or recent medication you changes. Do you have any recent medication chart, or you have previous medication chart, idiopathic lung fibrosis, infection, cystic fibrosis, childhood, obviously you have to ask the childhood history, bronchiectasis. So these are the first. And regarding the acid, like acid and acute infection, asthma, allergic rhinitis, ACE inhibitor induced, any kind of reflux. Joe nicely, Dr. Amani said that anything passing through a node, or you have to change the throat clearing, like regarding the aspiration, or you can say this is any kind of chastros, vasculitis, COPD, cancer. These are the, even though any kind of no question that Ramani was regarding the general question like weight loss, any kind of the changes of the appetite, you didn't ask any in general question. All is a very important, like you are searching any kind of the malignancy. So cancer, COPD, cystic fibrosis, all are the questions you have to specifically ask that I'm ruling out. Yes, HIV, any kind of the risk factor you asked already. Legionella question, even this was the one question, like any kind of the hotel stay there, you asked it is rural or urban, do you stay in a hotel, because in a kind of the air conditioning room, it can cause Legionella pneumonia as well. Drugs, ACE inhibitor, NSAIDs, these are the drugs are causing or this kind of the cough. It is a cough variant, dry or productive cough. Nature holiday said that dry and wet cough, infective exacerbation, any kind of infection, tuberculosis, Legionella, hotel stay, very important. Drug, very common exam scenario ongoing, drug induced, methotrexate, nitrofurantoin. Also cystic fibrosis, real exam question, my all candidates, that real also, even in the respiratory case, this is the, even in exam they'll be crossing. What do you think about this crepitation? Is it simple bronchiectasis? Is it simple lung fibrosis? What do you other causes? So you have to tell every point of view for getting full mark. So nowadays the clinical judgment, if nowadays the clinical association communication identifying physical sign, every point they'll cut you if you're not fluent. You have to be very fluent. You have to be, presentation is very important. And the clinical judgment, now they increase the mark. Previously it was 19, now 20 passing mark. So that what will happen, you have to approach nicely. Like Dr. Amani's management was not look good, because why? First of all, patient education counseling. Patient education counseling, mean, I'll say that yes, it could be associated job, so we have to stop this recent job as you're working. We understand that is very important for you. We'll involve the occupational health worker to convey or to relocate to you another way. Second of that will start the management to involve the respiratory physician, lung physician. So this way, 1, 2, 3, 4, you have step by step what you will do for a patient. So first of all, is it medical management or is it just counseling? So step by step you have to approach the management way. Your management was not also so organized, so it is also the clinical judgment wise they'll cut your mark. So overall this was the case today, and the cover in asthma and weight, this chart very important, we have to ask accordingly. Any question from anyone? Any feedback from any candidates? Anything? Yes, anyone to add anything? Yes, doctor.
Differential diagnosis of this case.
Yes, the differential diagnosis of the is acute exacerbation of asthma. Second is occupational asthma. Third is AC inhibitor induced, but it already stopped, so it's out of my DD. But it could be gastroesophageal reflux. This patient on the Gaviscon, so patient was telling it's not bothering me a lot. It's not acid sensation now, but I'm taking Gaviscon, so you keep it is in this way 1, 2, 3. Mostly first two is that acute exacerbation asthma. Second is occupational asthma. Third is that AC inhibitor induced, though it stopped, but it could be one factor. Third is gastroesophageal reflux disease.
Okay, Dr. Eileen, about question condition improve apart from occupation. It's important here because your answer may not improve.
Yes, I said you have to say that in this occupation you are baking this bakery shop. It is the most predominant factor for having exacerbation. So you have to keep away from this exposure, so that you have to say that I said I didn't notice. Mean you have to say, do you think when you're away from your job, I mean any kind of the winter, any kind of season or an off period, I said I didn't notice. It is biasing you, that misguiding you. It doesn't mean that it's anything important, but you have to be strict. Like, I'm not telling you every positive point, because as I'm a surrogate, so you have to think, okay, fine, but it doesn't mean, okay, I'll tell you, yes, when I was in the off of my day or my holiday, I feel good. No, it not sounds like that way. So try to think, when I started the job around 8 months back. Now it started 7 months already. I stopped this inhibitor, starts aggravating in fractures. So do you think that how long you have to do work there? I say it already that night is aggravating more. Whatever the shift duty, actually you have to ask more question, my occupation related, exposing related, Dr. Amani. Clear? So this is the main point, that you have to evaluate occupation related asthma. Dr. Amani, is that clear?
Yes, clear. So thank you. Doctor, regarding the chest findings, there was bilateral basal Krebs and some bronchi, right?
Yes, yes.
Okay, so this Krebs would be because of the infection.
Infection, yes.
But why is it bilateral?
Asthma finding always bilateral. It's not unilateral, right, Dr. Fatima? It's always
Yeah.
bilateral. Yes.
But the Krebs will not be present in the asthma, right?
Krebs is an infection exacerbation, as it is now said, I am coughing more. So that is a bilateral finding. It could be. It's not like a bronchitis. It's not like a pneumonia. It's not like that. It's a bilateral finding.
Okay,
It's a real
so there was
picture. Yeah, that's a
bronchi
bronchi.
along with it.
Yes,
Okay.
bilateral finding. Yes.
Thank you.
Thank you,
Dr.
doctor.
Eden, about bronchial breathing, also in asthma, in the lower nose.
Bronchial breathing, actually, who given this feedback? This is pneumonia exacerbation, something else. Just if you say pneumonia, it could. I want to. You said just as I'm seeing the bronchial sound, it could be pneumonia also. But I want to confirm it by seeing the extra. That's it. Bronchial breathing, it doesn't always sounds like it's pneumonia. It could be bronchial breathing, any kind of the vascular prolonged expression in asthma as well. Okay, that sounds like always not, no, never to think that's only for the pneumonia. It could be association asthma as well. Okay, but you have to confirm by doing the X-ray, bedside X-ray, or doing the X-ray to find out is it any possibility of the pneumonia or not. Clear, Dr. Ramani?
Yes, clear. Thank you.
Yes. So I believe it will be very helpful regarding to this discussion. Thank you so much, and I'm ending the session.
Thank you very much.
Thank you, Dr.